Hi, my name is Kari Hatfield, and I am a nurse practitioner and Doctor of Nursing practice student. I live in Metro Atlanta. At the end of August, I started working at Emory University Hospital in the surgical transplant ICU, and I care for some of the sickest patients you could possibly imagine. It is a fast-paced environment, and patients can deteriorate very quickly, so I have to constantly be on my toes. It is both humbling and rewarding to work with this particular patient population, and I am learning new things every day. It can be sad at times, but it is also immensely inspiring to see patients recover, to take their first steps after being bedridden for months, and to finally talk after being attached to a ventilator. Outside of work, I am in my first semester of the DNP program at Emory with a focus on population health. In the future, I would like to work in academia and research, and also in global and humanitarian health. I ultimately chose a career in healthcare because I wanted to help people. My first degree was in education, and after graduation, I joined the Peace Corps and I taught English as a second language in China. While working in China, I decided that I wanted to do more and to give more, to work in 3 dimensions. As a teacher, you're responsible for the intellectual and emotional development of students, but as a nurse and now as a nurse practitioner, I teach, I encourage, I empathize with patients while also providing direct hands-on care to my patients, which is the 3rd dimension that was missing as a teacher. My path to healthcare wasn't exactly direct, but in many ways I feel it was inevitable. My maternal grandmother was a nurse. My mother was a nurse, and she just retired after 40 plus years of service. And now I am a nurse. I'm a 3rd-generation nurse. In fact, this charm that I wear was a gift from my grandparents to my mother when she graduated from her nursing program. And then my mother gave it to me when I graduated. To be a nurse practitioner means to care, to empathize, and to heal patients and to be present for them in their time of need. I want to make a positive impact on communities here and abroad by working for health equity and to work for comprehensive universal health care that is accessible to all people at all times. I want to work alongside communities in low resource settings to help train the next generation of nurses and healthcare workers. It's hard to say what impact I'll have in the next 5 to 15 years because I'm interested in so many different things. But one area of healthcare that I'm especially interested in is caring for patients after they have prolonged stays in intensive care units. More and more, clinicians are realizing that patients often experience something called post-ICU syndrome, or PICS. And what this essentially means is that patients may experience PTSD, cognitive decline, and memory problems, and prolonged weakness as a result of their long hospital stay. And I'm interested in studying this to see what improvements can be made when a patient is discharged. I'm also interested in looking at the more personal side of this in terms of how a long ICU stay may affect a person's romantic relationships with a partner or a spouse, or if they're going to be dating after their illness. Oftentimes patients leave the hospital, they have new scars, they may have had a traumatic amputation or serious injury that has left them disfigured. And so I'm really interested in looking at how their self-esteem may change after their illness or their stay and how that affects them. Few fun things about me. My birthday's on Halloween. I take my coffee with cream and sugar. And one piece of advice that has stuck with me that has been really valuable is I started my first job at a fast food restaurant, and my mom dropped me off for my first day of work. And the first thing that she said to me as I got out of the car was, always wash your hands. And that was really good advice then, working in the food industry, and it's also really good advice now working in healthcare. Thank you.